Welcome, everybody. We're just going to wait a few minutes while everybody gets logged on here. Well, good afternoon, everyone. Thanks for joining us today. We'll be discussing the exciting and complex topic of healthcare during retirement. But before we do, I would like to introduce you to Julia Fuentes. She currently serves as Vanguard's financial planning and coaching strategist. Since joining Vanguard in 2008, Julia has assisted financial advisors with their investment strategy, practice management, and sales needs. Prior to Vanguard, Julia was a financial specialist with Wachovia Securities and a credit manager at Wells Fargo Financial. She earned her BS in finance and marketing from Bloomsburg University. And for those of you who may not know me, I'm Allison Barrientos, partner and advisor here at Integris Wealth Management. I'll be moderating the discussion today and relaying your questions to Julia. Jenna Reynolds, our Director of Operations, is managing the back end of the webinar today and has a few logistical items to share with us before we get started.
Thank you, Allison. If this is your first time attending a Zoom webinar, I would like you to know that we encourage engagement. On the toolbar at the bottom of your screen, you'll notice there is a Q&A icon. As you have questions throughout the presentation, please feel free to ask us by clicking on this icon. We will be monitoring as new questions arise and will forward them along as we go or catch them all towards the end of our presentation. Additionally, a quick disclaimer, this presentation is intended for educational purposes only and should not be considered investment advice. And with that, Julia, would you like to kick us off?
Perfect. Thank you so much. So this is a topic I am very passionate about. This is something that a lot of people kick the can too long trying to figure it out, but we really need to plan for our healthcare costs in retirement, because this could potentially be the largest cost that you are going to face on a monthly basis. So we need to plan for that. So we're going to talk about how to figure out what that budget line item number is. We're going to talk about the ABCs of Medicare. I'll point out mistakes some people make along the way. We're going to go into your income and how that is tied to what you will pay for your monthly Medicare premiums. And we will wrap up with a conversation on long-term care. So when we think about the two buckets that you need to work with your financial advisor to plan for, these two buckets, really important and different in their own ways. The left-hand side, your traditional healthcare costs. This is you're going to the doctor, you're getting your prescription drugs filled at the pharmacy. And these top two line items, those are going to be covered by your Medicare plan. But then there's other costs that Medicare doesn't cover, such as dental, vision, hearing aids. Those are covered by the typical Medicare plan. But when I talk about dental, this is something where some people choose to pay out of pocket for. Some people will seek out an additional dental insurance policy in retirement. But a great starting point for that is to talk to the dentist you want to go to. They can give some pretty good advice. I was actually at my dentist this morning and I heard somebody say, oh, I'm retiring, next year, trying to figure this out. And I heard him doing the right thing, asking the dentist what they should think about for insurance. Vision. This is your eyeglasses, eye exams, contacts. That's what's not covered. If you have an eye problem, like you need cataract surgery, that will be covered under Medicare. So this is really talking about glasses and just routine eye care. Now, the traditional healthcare cost bucket. This, you're going to see numbers in the news that say, typical American couple needs more than $300,000 for their healthcare costs in retirement. But you don't see a news article saying, hey, typical American's going to need $500,000 for their food in retirement. So the way we want to think about this bucket is we want to break it down to a manageable number. We're going to budget for this on a monthly or an annual budget line item expense, just like we think about our monthly grocery bill. Now, the other bucket, the long-term care bucket. Some of us, as we age, we're going to need a little bit of help doing what they call the activities of daily living. I need help getting out of a chair. I just can't. I'm a little too weak to do that now. I need help going to the bathroom. These expenses and these services are not covered by Medicare, and you're on your own. So if you get Lewy body dementia, Alzheimer's, you have to go into a nursing home, you're on your own with the expenses. So this is a risk. So we need to talk to our financial advisor about how do we insure ourselves against this risk. We may or may not need these paid services, but if we do, how are we going to pay for them? Some people say, well, eventually, doesn't the government pay for your nursing home care? And what you're thinking of is Medicaid. Medicaid aids the poor. Medicare cares for the elderly. So to qualify for Medicaid, you have to have very low assets, very low income. It is state specific. So since we don't plan to be destitute in retirement, it's not a good plan to be on Medicaid in the future. So we're going to plan differently. Talk to your advisor about that bucket. So eligibility, when can you go on Medicare? You are first eligible for Medicare at age 65. Some people that are disabled can be on Medicare earlier, but most of us, 65 is the age. You can enroll 3 months prior to your 65th birthday month in order for your coverage to start on day 1 of your 65th birthday month. You also have 3 months after your 65th birthday to enroll. This 7-month window around your birthday is called your initial enrollment period. And initial enrollment window. And this is important because this is where they're going to look to see if you signed up to assess penalties. But you might be thinking, I'm continuing to work well past age 65, and I love my insurance plan at my employer. Do I still have to sign up, or will I get penalized? And the answer is, it depends. It depends on your employer and the type of health insurance that they offer. So let's say most people, you're going to fall into one of two buckets. You work for a small employer, 20 employees or less. This type of employer, typically insurance is not creditable health insurance, which means, yes, you do need to sign up for Medicare at age 65 to avoid potential future penalties and also coverage gaps. So small employer insurance, you're at risk that your insurance is not Medicare delay eligible. But for many of us, we work for larger employers, more than 20 employees, which means we have creditable health insurance in most cases that allows us to delay signing up for Medicare until later in life during what is called a special enrollment period. You will get an 8-month window from when you lose coverage. Let's say you get fired, you'll have 8 months to figure it out to sign up without a penalty. The same goes for if you are riding on your spouse's health insurance plan through their employer. What we need to do if we're turning age 65 and we want to continue on the insurance plan that we're on, we need to talk to our benefits administrator and make sure that we get a letter, we get confirmation that we have creditable health insurance coverage and a creditable drug prescription plan. That's to check the box, because later in life, when you do sign up for Medicare, you will need to prove that you had this eligible health insurance coverage from the day you turn 65. You will prove it to them. Really easy to prove. It's just a letter that your employer signs. Some of you might be thinking about retiring early, like 65, no way, I'm done at 60. Well, you're going to need to bridge the gap to Medicare. Health insurance can get pretty expensive, and it gets even more expensive if you don't have health insurance and you get into an accident. So maybe you have retiree health benefits. These are becoming less and less common. We're seeing less employers offer this, but you might be lucky enough to have this from your employer. But if you don't, we can turn to our spouse's health plan. Maybe you can convince your spouse to continue to work and you can retire and go on their plan. But we know that that doesn't always work out. Both spouses want to retire around the same time, which brings us to COBRA. COBRA continuation insurance. This is a short-term solution, typically will last 18 months. So could be appropriate for somebody, 63, 64. COBRA means you can continue with the exact coverage that you had through your employer. So it continues as is, but now you pay the full boat. You pay the premiums you were used to paying, what your employer would subsidize for you, and an additional 2% administrative fee. So since this gets pretty expensive, a lot of people turn to the Affordable Care Act marketplace plans. If you go to healthcare.gov, this is where you can select the exact state that you are a resident of. That's important because it will bring you to the appropriate state exchange. Every state does it a little bit differently. It's important to put your income in there because depending on your income, there are subsidies that are paid by the states to lower your monthly premiums. So I'm going to throw out like a ballpark national average number here. But if, let's say you're married, filing jointly, your income is under $240,000, most likely you will get a subsidy to help lower your monthly premiums on these plans. Talk to your financial advisor about income planning to try to keep your income low in these years that you're on the Affordable Care Act plans, because it really can save a lot of money. If we can't get your income low enough, you might shop directly with private insurers to see if you can get better pricing, better coverage networks for the price that you're paying. I want to stress COBRA and Affordable Care Act plans are not Medicare delay eligible. When you turn age 65, you do need to sign up for Medicare. So now we're going to go into the ABCs of Medicare, what we call Medicare's alphabet soup. Part A. Part A is your hospital coverage. This is the one part of Medicare that is free. It is free if you have put in 10 years of work or your spouse has put in 10 years of work. So you will get that premium free. So at age 65, most people sign up for Part A because it's free and it gives you additional coverage. There is one reason you would not sign up for Part A at age 65, and that would be if you want to continue to contribute to your health savings account. So that's for people that you work for that larger employer, you have creditable health coverage, which happens to be a high deductible health plan with a health savings account. If you sign up for Part A, you are no longer eligible to put money into your HSA because Medicare is now your primary insurance. So you can still spend from the HSA, you just can't put more money into it to use it as an investment vehicle. But if you don't have an HSA, no worries, sign up for it. Also, just know when you take your Social Security retirement benefits, it comes with Part A. So you get that when you sign up and you're older than age 65. So some people, have to plan to stop contributing to their health savings accounts 6 months before they sign up for Medicare or take their Social Security benefits, because they do backdate your Part A start date by 6 months. So work with your financial advisor to organize that if you have a health savings account. Now, Part B. Part B is your medical coverage. You go to a doctor, you go to a specialist. There's a lot of costs wrapped up into Part B. In 2023, the monthly premium, the lowest that anybody's paying in the entire country, is $164.90 a month per person. Once you start taking your Social Security benefits, this gets netted right out of your Social Security check. If you're not taking Social Security, they will bill you quarterly for this, or you can set up auto pay. Now, another note on Social Security: if you take your retirement benefits, your Social Security retirement benefits early, let's say age 62, 63, 64, you will get automatically enrolled in Parts A and Parts B. You will get your cards in the mail. Your Medicare cards come about a couple months prior to your 65th birthday. You can disenroll in Part B and send the Medicare cards back if you, let's say you're on your spouse's health plan. Those are the only people that get automatically enrolled. Everyone else must take action and enroll. And the reason why it's important is Part B and Part D. D is for drugs, your prescription drug coverage. Both of these come with lifelong penalties that we want to avoid. Part B, there is a 10% penalty for every single year that passes that you could have been signed up and you did not. The worst case I ever saw with a Part B penalty is a small business owner. He didn't realize that he was supposed to sign up for Medicare at age 65. He had small employer health insurance. It was not creditable. 18 years passed. When he signed up for Medicare later in life, once he retired, sold his business, he had a 180% penalty tacked on to Part B for the rest of his life. So avoid that situation. Same thing happens with Part D. So everybody takes different drugs, goes to different pharmacies to get them filled. So there's a lot of different drug plans available to you. What happens if, let's say you don't take any drugs? Why would I sign up for a drug plan then? And you try to sign up later in life when you start taking a lot of medications, you will be penalized. There's a 1% penalty for every single month that passes that you could have been signed up and you did not. And they base that penalty on the national average monthly premium. Going into 2024, I think it's somewhere around $55 a month. Now, if you're somebody delaying signing up for Medicare because you're still employed or your spouse is still employed and you want to continue with that coverage, you want to just check, do I have creditable medical coverage so I can delay Part B? Also, do I have a creditable drug prescription plan to allow me to delay signing up for a Medicare drug plan? Cover your bases. Now, the combination of Part A and Part B is what is referred to as original Medicare. And the risk here is there are unlimited out-of-pocket costs associated with original Medicare. And to simplify it, it's 20% out-of-pocket. So you go and get a $50,000 chemo treatment, you owe $10,000. Later on in the year, you get a $50,000 outpatient surgery to remove a tumor, you owe another $10,000. So people choose to protect that risk. And usually, typical person has two avenues to go down. Am I going to do a Medigap supplement plan, or am I going to choose Medicare Advantage? We're going to talk about both today. There is a third option for some people. Let's say you're working at that small employer. You can use your small employer insurance as secondary coverage to pick up those costs, or maybe you are a military person, you've retired from the military, you have TRICARE. TRICARE for Life can pick up these costs. Maybe your former employer is offering you a retiree health package. A lot of these retiree benefits that come through in the form of a Medicare Advantage plan. But we're going to talk about Medigap first. Medigap.
Julia, before we jump into
sure.
Medigap and Medicare Advantage,
Sure.
to clarify, is the penalty for delaying signing up an increase of the premium, or is that a separate fee?
It's basically, it gets added onto your premium. So your monthly premium is going to be like, if you're 70 and you were supposed to sign up at age 65, you get a 50% penalty of whatever Part B is that year. Each month you're going to have to pay more. They increase that premium forever.
Understood. Thank you very much.
So with Medigap, Medigap's offered by private insurers like Aetna, Humana Gold, United Healthcare, Cigna, all kinds of different insurance providers offering these. People love Medigap plans because you can go to any doctor in the country. If they accept Medicare, they will accept your Medigap supplement plan. So wide coverage network. So this is state specific, but most states follow these rules. The first time you sign up for Part B, your medical coverage, you will get a 6-month window to sign up for a Medigap supplement plan with no medical underwriting. After the 6-month period, they do full medical underwriting to determine your premiums, and you can be denied coverage. So I'm just throwing that out there because some people get boxed out of Medigap because they didn't understand the rules in the beginning. The first time you sign up for Medicare, if you have a pre-existing condition, you have to really think about your choices. So I'm going to show you, this again is alphabet soup. I'm going to simplify this for you, so take a breath. There's lots of letters here. This is standardized by the federal government. The federal government sets the letters and they set the benefits. So the benefits you're looking at, this is the out-of-pocket costs you would face if you just had original Medicare Parts A and Parts B. And keep in mind, Medigap Plan A is not the same as Medicare Part A that we just spoke about. So this is where all these letters get really confusing. So the states regulate health insurance. So we talked about that 6-month period. After the 6 months, you can be denied coverage. There are 3 states that do no medical underwriting all year round. It's New York, Connecticut, Massachusetts. There are other states that they have slightly additional protections, that they have something more nuanced, like the state of California. If you have a Medigap plan, around your birthday every year, we're going to allow you to shop it with no medical underwriting to see if you can get a better premium. But just to give you a couple examples of state-specific nuances, but most states, 6 months, and then you're out. So there's a risk here not knowing about this and not thinking about it early on. So Medigap C and F as in fantastic are closed to new enrollees to Medicare. So if you are just enrolling, you're newly eligible, you cannot get C and F. Medigap G, I remember it as the Great Plan. So Medigap G, the Great Plan, is the plan that exists today that gives you the most benefits. But also, since it gives you the most benefits and the least out of pocket that you would pay, the monthly premium, we would expect it to be a little higher relative to others. So according to Kaiser Family Foundation, 55% of people enrolling in Medigap plans are choosing Medigap G. 40% of people are choosing Medigap N, the really nice plan. So let's look at what you get for these. Part A and Part B have co-pays, co-insurance. We talked about that big one, the 20% out of pocket. I do want to mention skilled nursing facility. Medicare will cover you for 100 days in a skilled nursing facility if it is part of your rehabilitation and you are improving in health. Once you're in the facility for more than 20 days, you owe $200 a day. That's what your Medigap plan will pick up. There are deductibles associated with Medicare. You pay $1,600 when you go into the hospital. You might have to pay that more than once in a year. Part B deductible. In 2023, you pay $226 before your health benefits kick in. So you might pay a little bit more in January. So you can see, G, the really great plan. All of your out-of-pocket costs are covered with the exception of that small deductible you pay early in the year. The difference between G and N, the really nice plan. N, you will pay a lower monthly premium. So I'm in the state of Pennsylvania. I'll just give you a benchmark here because it depends on where you live, what these are going to cost. In the state of Pennsylvania, my mother, she pays $175 a month for Medigap G. My aunt has Medigap N. She pays $120 a month. But with N, you pay $20 when you go to the doctor, $50 when you go to the ER. And they won't cover what is called Part B excess charges. There are some doctors that think they're worth more than the Medicare negotiated rates. They can bill an additional 15%. You are on the hook for that if you have N. If you have G, you don't have to worry about it. Go to any doctor. So some people think it's worth it for the lower monthly premium to go with N because their doctors don't charge excess charges. I do want to mention if you are somebody that does a lot of foreign travel, you're planning on living in Italy for 6 months, you do want to seek out a travel foreign health insurance policy as Medicare covers you in the United States, not internationally. Your Medigap plan can pick up emergency charges with a lifetime cap of $50,000. So we talked about original Medicare, add a drug plan, add a Medigap plan. That's your worst case scenario protection. You can go to any doctor in the country. Your insurance will be accepted. First time you sign up for Part B, 6 months of no medical underwriting that they have to give you the best available price out there, only asking your gender and your smoking status. Now your other option, because you don't do both, you get Medigap or Part C Medicare Advantage. So Part C Medicare Advantage means the same thing. Now you still need to be signed up for Part A and Part B, your original Medicare, but your claims are being run through the Medicare Advantage company. And in turn, because your claims are being processed through them, the government will pay them to take you on as a participant. The more enrollees that the Medicare Advantage companies get, they get financial incentives. And the more people that sign up, as an insurance company, your financial ratings can go up and you get additional financial incentives if your financial ratings are higher. So this is a numbers game. We want enrollments. I'm an insurance company. This is going to be lucrative for me. We want enrollments. So if you ever wondered why you get 30 mailers every year around Medicare's open enrollment, that's why. They want you to sign up because as a collective, they're going to make money if they can get a lot of enrollees. So you'll see a lot of commercials, bells and whistles, a gym membership, a toaster oven, dinner with a celebrity, dental vision benefits, 0 monthly premium. They all are different. The reason why you're protected from unlimited out-of-pocket costs is because every plan sets a maximum out-of-pocket limit. And right now, going into 2024, it's just under $9,000 for in-network services. So once you hit $9,000, you're covered. So you are protected up to your maximum out-of-pocket limit. But notice I said in-network. These are network-based. You need to understand the network of doctors. If you are a snowbird that lives between two states, you really need to make sure you can go to doctors in both states because it is network-based. Also, they do require pre-approvals, pre-authorizations for procedures. You might have to wait to get a knee replacement 6 to 9 months while it goes through the authorizations. Many of us are used to that from our working careers, so it doesn't bother us. Nothing wrong with either option, just know the differences. So I like to insert and use my mother as an example here. Although she hates me to use her as an example, I always do. She is very healthy, no underlying conditions, but she is accident prone. So people say, oh, sick people love Medigap plans. Healthy people love Medicare Advantage plans. Because Medigap, my mother pays $175 a month. Her best friend pays around $15 a month in a Medicare Advantage plan. So obviously they're always talking about what they're doing. And my mother says, well, I want to do Medicare Advantage. Well, my mother lives a couple hours away from her best friend. So that makes no sense. She doesn't understand the network. She can't name one doctor in the network. So you can't just say, I want my friend's plan unless you and your friend have the same exact health situations. We need to check the network. Well, my mother gets a recluse spider bite. She tends to get one accident a year that's pretty big. Well, we didn't know it was a recluse spider bite. And she goes to her primary care doctor. They send her home with an ointment. They don't know what it is. She pays no copay. She has the Medigap plan. Couple days later, she's not feeling well. It's really getting worse. So she goes to the ER. Since it's the weekend, they send her home with an antibiotic. No copay. She has the Medigap plan. Well, she's sitting at home for over a week, maybe a week and a half passes, and she's getting really, really sick. She hasn't been diagnosed yet. The antibiotic's not working because it's a poisonous spider bite. So in the meantime, there is a hole in her chest that is formulated and it is grown into this big hole that's eating away at her chest. So when I go to visit her, she's laying on the couch and she looks terrible. And she said, can you just look at this insect bite and see what you think? And when she pulls down her shirt, it was like right under her neck. It's a huge hole in her chest. I'm like, she said, I'm waiting for the antibiotics to work. Well, they're not working. So we're able to look up best dermatologist in the area that can treat insect bites. We're able to go to that doctor. Immediately they diagnose her, call an ambulance. She spends 20 days in the hospital getting pumped with the anti-venom, whatever they do in the hospital to get that out of your system, reconstructive surgery on the hole, and a year of dermatologist visits. That's zero you pay out of pocket. She pays that $175 for the Medigap premiums. Now let's talk about if she had Medicare Advantage. Well, she would pay when she went to the primary care doctor, whatever the costs are. Every plan is different. Let's say it's $40 for a doctor's visit. Then the ER, maybe it's $100 copay. So you pay for your care as you go. $1,600 deductible for the hospital stay. All these costs up to her max out-of-pocket limit. Let's say it was set at $8,000 because every plan is different. It just be more than what the government says it's at. So she would pay up to that. So in a year that she has an accident, she makes out with the Medigap plan. If she had no accidents and didn't go to the doctor, she would pay less in the Medicare Advantage plan for that year. So pros and cons to both. To bring it all together, 2023, Part A, we talked about how hospital free. Part B, nobody can escape the $2,000 that you pay for your Part B premiums, comes right out of your Social Security check. Part D for your drug plan. $400 is the national average monthly premium for 2023, plus your out-of-pocket drug spending. And then Medigap Plan G depends on where you live. It can range. Just know if you get in during that no medical underwriting period, they have to give you the best available rate out there, not knowing your health situation. I'm going to give you one example because it's fresh in my head because it literally was from Friday. There's somebody in California. She has had a Medicare Advantage plan for years, loved it, never had a problem with it. There's never medical underwriting for Medicare Advantage. She's 91 years old. She's been going to her doctors for a very long time. She loves her doctors. They decided going into 2024, they will no longer accept Medicare Advantage. They are done. They dropped all the plans, gave notice to their 30,000 patients that are on Medicare Advantage. Now, what is this 91-year-old woman to do? In order for her to get a Medigap plan, she needs medical underwriting. We don't know if she's going to get approved or not. If not, she needs to switch her doctors or pay 100% of the cost out of pocket to see them. So it's like, you know, pluses and minuses. She was great for a really long time. So we'll see what happens if she gets approved for the Medigap or she has to change her doctors. Now, the big whammy.
Yeah, before we move on, I have a couple of questions that have come,
Sure.
if you don't mind.
Absolutely.
And one of them really relates to flexibility, and I think you spoke to it a little bit in your example. If somebody has Medicare Advantage or Medigap coverage, what is the flexibility of moving between the two? And then also, once you're in Medigap and you select G, the great plan, or N, the nice plan, and then want to shift, how and when could you do that?
Yes, great question. So right now we're sitting here in Medicare's open enrollment period. It's every year, October 15th until December 7th. What Medicare open enrollment means, it's for people that are on Medicare. It's the one time a year you can change your Part D drug plan or your Medicare Advantage plan. So this is the time for drug plans, Medicare Advantage plans. The reason why this is extremely important, every September, you will get an annual notice of change that is sent to your home, and a lot of people throw it out. But that annual notice of change might say that your drugs are being dropped from the formulary and they're not covered under your plan next year. It might say your costs are changing. The deductible on your Part D drug plan is going up by $1,000. So if you don't take a lot of drugs, that's probably not the best plan for you. Medicare Advantage typically has the drugs wrapped up into it, or your notice of change might say your doctor's leaving the network. So if you do nothing, your plan rolls into the next year and you're stuck with it until the next open enrollment period. So Medicare Advantage, right now, you can leave your Medicare Advantage plan, join another one. You can leave your Medigap plan and join a Medicare Advantage plan. You can just drop Medicare Advantage altogether and just have original Medicare. So this is the time. With Medigap, you are allowed to shop that plan whenever you want during the year. So open enrollment is Medicare Advantage, no medical underwriting for Medicare Advantage. You can get into a plan without them asking health screening. With Medigap, although you can shop it, like some people will shop it on their policy anniversary every year, although you can do that, there will be medical underwriting. And depending on your health situation, that could be good or it could be really bad. But let's say you shop it, they can't go and kick you out of your Medigap plan that you already have because of your health situation. So once you're in it, you're in it. They can't go and wildly increase your premium because you're unhealthy. They can increase your premium because you're aging. A lot of these use attained age. As you age, they will increase. But I mentioned earlier, there's a few like state-specific rules that come into play sometimes. And I'll give you an example. There's some states that have a birthday rule. Around your birthday, no medical underwriting. But most of those states that have the birthday rule, you can go down in benefits, but you can't go up. So you can have no medical underwriting and you can go down to an N, but you can't go from an N to a G. So check your state, because but most states, the bulk of them, hey, that 6-month period you get, they're just going to price you based on your health situation or deny you coverage. So that's how most of them work, with some additional protections for some states.
That's really helpful. Additional question regarding the high deductible plan G. Did you have any insight on that? I didn't see that covered on the page you previously showed.
So what happens with a high deductible G? So you're going to have to meet a deductible that I think we just have it in the fine print down here. Plan G and F have a high deductible version, lower premiums, max deductible of $2,700 in 2023. So they'll say, all right, once you meet the $2,700 deductible, you will get all of these benefits. And then what happens is the monthly premium, instead of being I'll just use my mother's example, instead of being $175 a month, her monthly premium might be $40 a month. So you get a lower monthly premium, but you have to hit the deductible before all these benefits kick in. So that is like a different, it's not available in every state, but a lot of states will have Medigap G, regular version, high deductible version.
Thank you. And there seems to be some need for clarification around when, both initially and when changes are made, there will be a need for medical underwriting. Can you clarify that?
Yes. So when you first sign up for Part B at age 65 or later in life, if you've delayed, no medical underwriting for 6 months. You get 6 months to sign up for this Medigap plan, no underwriting. Medicare Advantage, never medical underwriting. You don't have to worry about it. They won't do underwriting with Medicare Advantage. Everyone can get that. Let's say you've missed your 6-month window. You've been on Medicare a couple years and you decide, I really think I would like that Medigap plan. They will do a health screening. They'll ask you your whole health history and they will price you accordingly. So if you have a medical condition, they'll either adjust your premiums higher to account for that, or they could say, you know what, we're not going to cover you, but you can always fall back on a Medicare Advantage plan. And any other clarifying questions?
No, that was it. Thank you very much.
Perfect. Well, the last thing that you really have to pay attention to, work closely with your financial advisor around, is your income and how it plays into all of this. There is something called Medicare's income-related monthly adjustment amount. On an annual basis, the Social Security Administration is pulling your tax return from 2 years prior. So your 2023 Medicare premium is based on your 2021 tax return. What they're looking at is your modified adjusted gross income. So if you pull out your 1040 tax return, they're looking at line 11, your adjusted gross income, and they're adding in municipal bond interest, line 2A. So any muni bond interest is included. If you are a penny over 97,000 or a penny over 194,000, they start to assess surcharges that you will pay more for both Part B, your doctor's visits, and they will tack a surcharge on your drug plan. So whatever your plan premium is, they tack on an additional monthly surcharge. The numbers you're looking at are the monthly per person costs. So if you're married and you're both on Medicare, you take this times 2. They recently announced the IRMA thresholds for going into 2024. So they have adjusted these for inflation a bit. So for a single person, you now are safe up to $103,000 as your income. Married couple, $206,000. And then they start to whack you, and the IRMA surcharges are a little bit higher than they were in 2023, as we can expect, as well as the Part B premium for 2024 is $174.70 a month. So we'll say it went up by about $10 a month. So it does change annually. Well, this is something you really want to work with your financial advisor on. You know, everything hits line 11, a lot of things, required minimum distributions once you turn age 73, 75, whatever your date of birth is. You turn on your Social Security benefits. 85% of that in many cases is taxable income that hits your tax return. So some people turn on Social Security and they get hit with IRMA surcharges. This comes right out of your Social Security check. Maybe you're getting an inheritance from your parents. Well, now we have to liquidate these retirement accounts over a 10-year period. So a lot to talk to your financial advisor about. Income planning, accepting your inheritance so you don't get nickel and dimed along the way. How are we going to accept this to try to reduce all these things and these surcharges, additional taxes? Also, if you're somebody that you have a huge traditional IRA balance and you want to take a lot of money out of that to pay for a vacation home, well, that throws taxable income on your tax return. You might have to pay more for your Medicare premiums for a year. This resets annually every year. You'll get your IRMA notices in November. So you probably are getting them. If you're on Medicare, you're going to get them any day if you haven't gotten it already over the next couple weeks. It'll tell you what your 2024 Medicare premium is based on your 2022 tax return. Another thing I want to note, if you are somebody recently retired and your income has drastically dropped because you've lost your employment earnings, a lot of times you have to appeal the IRMA surcharges they're assessing to you. They are looking at a stale tax return. So if you're single and you made $200,000 while you were working full-time and now you make $75,000 in retirement, you have a lot of Roth assets that don't hit your tax return. Well, you need to appeal the IRMA surcharges or you will pay too much for your Medicare premiums for 2 years. So work with your financial advisor. If you're somebody that wants to consider a Roth conversion strategy, hey, try to do that before it gets counted into your Medicare premium equation. So start that strategy early. So we're going to wrap up with long-term care. Depends on where you live. Long-term care expenses do differ. This is just national averages from 2021. But you can see, nursing homes can get quite expensive. Medicare is not going to cover these costs. Even though 50% of people don't have any paid long-term care, they may have family willing to take care of them. There is a risk, especially for women, that you will need paid long-term care for more than 5 years. And the risk here is 18% of retirees can expect to pay more than $250,000 in this bucket. So it can get expensive. A lot of people need around $100,000. So work closely with your financial advisor on this bucket for retirement planning. Am I going to set money aside just in case I need a little help as I age? Am I going to seek out insurance policies? There's lots of long-term care policies, a lot of what we call hybrid policies these days, where you can get a life insurance policy with a long-term care rider. So if you don't use the long-term care rider, the money will get paid out as a death benefit. So talk to your financial advisor about what's appropriate for you, because it's highly customized to each individual circumstance. So what I want you to do on an annual basis, review your income, your insurance policies, your health care with your advisor annually. We say annually because we just saw with income, you can really affect your Medicare premiums year over year. Also, during Medicare's open enrollment, we talked about shopping your plans. Price your drug plan. Look at your Medicare Advantage plan. It's your one time you can switch, avoid mistakes. We don't want you to pay too much, have coverage gaps, have your doctor leave the network, have your drugs not covered. Protect yourself, paying attention, shopping them. If you don't have healthcare directives, talk to your advisor about that. And also, if you're still working and you have access to that health savings account, you can fully fund most of these costs with health savings accounts, including that long-term care bucket. So a lot to talk to your financial advisor about. And with that, I can open it up with any last questions that might have come in.
Yeah, Julia, there is a couple of additional questions. The first one is, will premiums decrease if or when income decreases? And if so, what is the delay for that downward change?
Yes. So what they do is on an annual basis, so around this time period in November, they're pulling your most recent tax return. So every year it's going to reset. So if your income lowered a lot in another year, it will reset and you will pay less for that year. But let's say the following year, your income went up again, you had a lot of capital gains in your investment portfolio and you liquidated it, then hey, for a year you'll pay higher. So it does reset annually.
That's good to know. Another question. Let's say that I'm still working, I'm over 65, I do have Medicare, but I also have my employer's health insurance plan. How do those two plans work together from a benefits perspective?
Yes, so with so it really comes down to that small employer versus large employer. So when you work for that small employer, less than 20 employees, your health insurance is secondary. So Medicare pays first, that health plan pays secondary. So let's say you never sign up for Medicare, you go to the doctor, they'll say, where's your Medicare card? Oh, I don't have one. And they'll bill you for 80%. And your small employer health insurance picks up the 20%. But now when you work for that larger employer, more than 20 employees, your work coverage can serve as primary. So a lot of people, I see people sign up for both Medicare and they have their employer insurance, and you don't really need it, especially if you're getting hit with IRMA surcharges. You're kind of double covered because your work coverage will be primary and then Medicare pays second, and they're not really paying like a whole lot out. So you're just paying, you're kind of paying double and you don't really need to. So it's, yeah, just something to look into. A lot of people with this large employer insurance, they can just delay signing up for Medicare and not have both.
Yeah, absolutely. From a premium perspective, that sounds like the right way to go.
Yeah.
I think that covers all of our open questions. So what I'll say is I want to thank you all for your time today. We hope you all pulled some valuable insights from our time with Julia. I certainly know that I did. Julia, we really appreciate your time, expertise, and your willingness to break things down into digestible components. I'm sure that I'm not alone in saying that I'm walking away with a few new nuggets of information, and I can't wait to put it into practice. So thank you and take care, everyone.
Thank you.